Vice President Mike Pence says some doses of the coronavirus vaccine could be distributed as early as mid-December. That's according to a document obtained by CBS News from the government's Operation Warp Speed. It says that the first vaccine deliveries by Pfizer are planned to take place December 15th. Moderna's vaccine would be available the following week on the 22nd. Now, the news comes as hospitals across the country continue to grapple with a surge of coronavirus inpatients. More than 96,000 Americans were hospitalized yesterday. And as of yesterday, according to the COVID tracking project, officials warn it could get worse. David Begnaud reports.
Our nursing staff is getting a little fatigued at this point.
This is Dr. Gina Hunke of Deaconess Hospital in Evansville, Indiana. She says the ongoing coronavirus pandemic is taking a toll on frontline workers. And nationwide, the flood of new coronavirus patients is showing no signs of slowing down. Hospitals in New York State are already short-staffed, prompting the governor there to announce emergency hospital measures. Now, his plan includes a call for retired doctors and nurses to return to the front lines.
In the new battlefield, hospital capacity is the top concern.
To the west now, the line of people waiting to get a coronavirus test at Dodger Stadium in Los Angeles stretched for miles Monday as cases across California continue to spike. Governor Gavin Newsom warned that he may institute lockdowns in the hardest hit counties to try and slow down the spread.
You can see in mid-December, California, the ICU beds will be at 112% capacity.
You know, despite an accelerating crisis, many Americans are still resisting basic efforts to control the virus.
I'll resist. And I'm not the only one who will resist.
Take Rapid City, South Dakota. Last night, residents debated implementing a stricter mask ordinance, not a mask mandate, after that state led the nation in coronavirus deaths per capita this month.
It's just a mask, wear it. This is a public health crisis. I don't know what else to say.
The measure passed 9-1, but some businesses can opt out and houses of worship are exempt. In other parts of South Dakota, some local leaders are taking no chances. This is a mandatory mask checkpoint set up by the Cheyenne River Reservation. 1 in every 4 tests here is coming back positive. To slow the spread, the reservation's largest city was placed on a 10-day lockdown. Tribal Chairman Harold Frazier says the reservation has only 8 hospital beds for the 12,000 people that live there. And if you want to get to the nearest ICU, you've got to drive 3 hours away.
Our main priority is to save our people. And we know that if there is a vaccine, it's going to be a long time coming. We as Indian people, we're always at the back of the bus on whatever it is. So I guess we'll just have to wait and see.
So for more on this, we want to bring in Dr. Dyan Hes. She's the founder of Gramercy Pediatrics. So, Doctor, the CDC's Vaccine Advisory Panel is scheduled to meet today to vote on recommendations about who should get a coronavirus vaccine first, once they're authorized, of course, by the FDA. So what is the committee most likely to recommend?
From what I've read, I think they're going to prioritize the elderly who are in nursing homes, because we're seeing 40% of the population who is dying from COVID is in this long-term healthcare facilities. So I think that will be the first. I think first responders, I saw a special last night on how the FDNY is going to be prioritized, ambulance workers, doctors, nurses. That being said, not everybody is going to be taking this vaccine who's getting offered this vaccine. And I think that's going to be our bigger problem, to know why people are refusing to take it or rejecting to take it. I really think teachers should be vaccinated, because I think that's the priority. We need the teachers back in schools. And I think they're very similar to first responders. They should be offered the vaccine as well.
Doctor, if someone has already had COVID-19, would they still need to get vaccinated?
So that's a gray area. When I was researching on the CDC website, they are saying that, we don't believe that you have long-term immunity to COVID, but I don't think they've tested, because I believe in most of the studies, if you already had antibodies to coronavirus, you weren't eligible to be in the study. But as a doctor, from other infectious disease standpoint, I think, yes, you should get the vaccine. I think it's going to be like the flu, that you're going to have to get, at least 1 to 2 shots every year. So I believe at some point it will be that even if you had coronavirus, you will be vaccinated.
So Moderna and Pfizer's vaccines are both up for emergency use authorization. If both become available for distribution by the end of the year, as planned, just how long could it take until we see herd immunity?
Oh, herd immunity is not going to come for a long time because only 3% of the population in general on the planet has had coronavirus, and you need 60 to 70% to reach herd immunity. So that is a long way off. So I would not rely on herd immunity to save us from coronavirus.
Earlier this month, Doctor, the American Academy of Pediatrics called on researchers to broaden their vaccine trials to include more children. So how significant could the delay in getting vaccines for children be given the timeline of vaccinating adults and the general public?
Well, I'm not so worried about the delay in reaching children because we're not seeing those high mortality rates in children. So I believe that if we can get the high-risk adults, the first responders, the teachers, and the elderly vaccinated, then the children will have much more freedom to go to school and to enjoy activities. And then when we have the studies completed in children, we'll be able to vaccinate the children. Because right now, we're just not seeing that high mortality rate in children. And yes, every death in a child is tragic, but right now we have to prioritize the group that is affected. And then Pfizer is enrolling 12 to 17-year-olds in their trial, and it will be coming down the pike. But until we have that data, the children are going to be the next group that's going to get it, or maybe the third group that's going to get it, let's say.
So we're getting some interesting results from an analysis of blood donations. And what it found was that COVID-19 was present on the West Coast weeks earlier than was previously known. A government study says the coronavirus infected people as early as mid-December of last year. Doctor, I'm sure you've talked to patients or people you know who have said to you, oh, I got sick in December or I got sick in November. And now that I'm thinking about it, it really reminds me of what they say COVID is like. What does this new information tell us about just how early and quickly the virus emerged and spread?
Well, I just think it shows that we don't live in a bubble. We had people coming from Asia. We had people going to Asia. And I mean, really, even as the pandemic started, I had a friend that flew over to Beijing. I'm like, are you kind of crazy? Like, why are you going there? Isn't there a pandemic starting? But it was before the borders were closed. And I mean, everybody was like, people were really harsh on President Trump when he closed the borders, but he did it for a reason. And it was because there was already coronavirus there. It was probably already in our country. I know Mount Sinai also is studying antibodies in blood in patients from January and February, and they've also found in New York that many of the patients who came in for routine, like labor and delivery to have a baby or a routine procedure, when they're checking their blood now, it also is positive for coronavirus antibodies, which isn't surprising. I had, I think I've told you this before at the beginning of the pandemic, I had several kids go to the hospital with something that we couldn't figure out, wasn't RSV, wasn't flu, didn't come up on any of the respiratory panels, but maybe it was COVID. We don't know. But all those kids did fine, but we just didn't know what they had.
Really interesting.
Yep.
Dr. Dyan Hes, as always, we thank you for your analysis. Appreciate it.
Take care.